Good day, everyone, and welcome to today's webinar, Becoming Patient and Survey Ready with RLDatix. At this time, all lines are placed on mute to prevent any background noise. We will have a question and answer period throughout and after the presentation. You can type your question in the pane at the bottom of your screen. If you'd like this presentation, please email me at mshaffer@cihq.org, or it should be available through your registration link. This webinar is being recorded and will be available at the partner YouTube channel within a couple of business days. Our speakers will be engaging and interactive. We hope you enjoy this presentation. There are no CEUs provided. Jaime will introduce the RLDatix presenters. Jaime De Santiago is the Product Marketing Specialist for RLDatix's compliance solutions, including policy management, one-source manufacturer's documents, and audits and standards. Jaime has experience working as a policy administrator at Cook County Health in Chicago, before transitioning to a product marketing specialist role at RLDatix, where he now helps bring awareness to the RLDatix patient safety mission. Jaime, you have the floor.
Great. Thank you so much, Michelle. And before we begin, we also want to thank CIHQ for hosting us for this webinar. We greatly appreciate the opportunity to share some valuable insights with you all today on patient safety improvements. We have an amazing group of presenters here today as well, who will share their stories and experiences about how they manage the rounding processes to become patient and survey ready with the help of our RLDatix solutions. I know most of you are used to these types of webinars, but like Michelle mentioned, if you could please leave any questions you have in the chat as we go through the presentation, that would be extremely helpful. We also have some poll questions that we want to have pop up on the screen for you all as well. So if you could please answer those and just help us keep this as engaging as possible, that would be fantastic. So with that being said, I would like to give an introduction to today's speakers. First up, we have Cheryl Kirchner, who will be guiding the discussion today. Cheryl is an RLDatix solutions consultant with over 30 years of experience in the healthcare industry, and that includes system-level healthcare leadership with a specialization in quality improvement, regulatory compliance, directing performance improvement initiatives for acute care hospitals, and a clinical background in critical care nursing. Next up, we will have Catherine Cunningham from the Center of Excellence at St. Luke's Health System share her experiences about becoming survey and patient ready. Catherine is a dedicated system quality manager with an accreditation focus at St. Luke's Health System. With nearly 20 years of experience at St. Luke's, Catherine has excelled in various roles, including clinical support, nursing, and accreditation. Her extensive background spans multiple clinical practice settings, such as medical, surgical, women's and children's health, clinical support staff, and ambulatory care. In 2020, Catherine earned her master's degree in executive nursing leadership from Walden University. Her expertise lies in standard interpretation, the survey process, and the integration of technology into accreditation processes at St. Luke's. Catherine's commitment to excellence and innovation has significantly contributed to the organization's success and quality of care. Then last but not least, we will have Audra Gebbing, who has been at RLDatix for 8 years and is currently a solutions consultant for our compliance-related products. Audra will be coming in to give us a short demonstration of our audits and standard solution before we dive into any questions you may have. Okay, and just a brief overview of the agenda today. We will have Cheryl present on some tips on how to improve your policy approval and survey readiness process. After that, we will have Catherine discuss how her and her team streamlined the rounding and audit processes. And then we will have Cheryl come back in to provide some advice on how to encourage interdisciplinary collaboration within your teams before we turn it to Audra to provide a demo of our audit and standard solution. And then lastly, we will wrap up with some questions. Okay, so we're going to test this out. We have one poll question for you all today. The first one here is, what is your primary area of work? We would like to get a gauge of just who's in the audience. I know we have several healthcare providers here, but please indicate if you work in compliance, accreditation and auditing, policy management, quality, or maybe you're in another field or department. So we'll give you all a couple seconds to answer those. And I'm going to try and see if we can check out the responses. Okay. Michelle, are you able to see the responses on your side?
Yes, sir. 35% work in quality, 23% accreditation or audit manager. Other is about 17%, policy management 16%, quality leads the pack.
Wow. Okay. Thank you, Michelle. So it sounds like we have a really diverse crowd, so we love to see it. Hopefully, we can all teach you something new today. And then one more poll question before I turn it over to Cheryl. We just want to get a gauge on how familiar you all are with our RLDatix solutions. Do you currently use Audits and Standards? Maybe you know it as Converge or Accreditation Regulatory. Do you utilize our policy management software, Policy Stats? Maybe you use both solutions. Maybe you're unsure if you use any of our solutions, or you know that you currently don't use any RLDatix solutions at all currently.
Okay. Currently, Policy Stat leads with 33%, both solutions 25%, unsure is 19%, and Audits and Standards also 19%.
Okay, perfect. So that actually leads me to my next section here, which I'm sure we'll talk a little bit more about policies. So you all policy folks will probably be familiar with a lot of this stuff, but we'll also be talking about Audits and Standards as well and how the two connect. So with all that being said, I think I've talked enough. I'll pass it over to Cheryl now.
Thanks, Jaime. Thanks for everybody for being here. I know you have a lot of options. We appreciate you choosing us today, and hopefully you'll learn a lot. I know you'll learn a lot from Catherine. As we are moving forward here, and before Catherine shares the St. Luke's experience, we'll take just a couple of minutes to orient you with a few basics around Policy Stat for anyone who is not familiar, and then we'll take a brief look at Audits and Standards and address the objective on improving your policy approval and survey readiness. So I'm sure most of you, being that you have oversight for policies, appreciate the importance of policy management. We all know that policies that are outdated, missing, or conflicting can all contribute to adverse events, complaints, infections, claims, and overall can lead to a decrease in the safety and increase the risk for patients, workforce, and your organization. So for those of you who are unfamiliar with Policy Stat, on the next slide, you'll see that Policy Stat is a web-based document management software for managing policies, procedures, and other documents. So there's a lot of opportunity here for linking documents, and that may include order sets or forms to policies, particularly when you have complex service lines like oncology and need to link those up. It provides on-demand access for those files from any device that uses an internet connection, and it's used by organizations to publish and share policies that are related to their programs, services, and procedures. Briefly, I'll run through a quick basic Policy Stat workflow, very simple example. Let's say our policy manager is Mark, who needs to create a new policy. So he logs into the system, creates a draft document. Once the policy has been created and assigned a workflow, it can be moved to a pending status for review and approval. The policy can now be reviewed by stakeholders and collaborators as it proceeds through the workflow. All comments are documented in the software, and while pending, a document's review steps can be repeated as necessary until the policy is approved. Once it's approved, the policy document will be published. This can default to an immediate or scheduled for a later date if you need to do training before it's published, for example. And finally, in this example, the approved policy will become active and published for user view. So that's just kind of the basics of how it works. And now we'll talk a little bit about some efficiencies in workflows. And there's a few tips here. First, you'll see there's an example workflow at the bottom of the slide. And it's shown here it's important to label each step. So instead of just putting an individual name, putting the role is very important. While you can list multiple names under a step, it helps to standardize the role if you have changes in the people who are involved in that workflow. So that's one way to just help describe the step. Another easy item is limiting the number of steps. As you can imagine, more complicated workflows can lead to delays. This is a great opportunity to take advantage of labeling the step for a committee, for example, and labeling it as the committee and listing just the chairperson or the co-chair instead of all the members. A good example would be for a medical staff committee or a board meeting where it may be difficult to gather up all the members to approve a document. You could have the chair or the chairperson or a designated medical staff person who can approve that policy and for the team, and you can reference or include the minutes to the meeting if you like to show that there was a quorum and that you had all the people that needed to approve it do so. On the next slide, there's a couple of other tips here. In policy stat, there are some easily available reports that come with the program. And the first one I'll point out is the turnaround time report. This report can be run for one or more areas, and it shows the number of steps and the days per step for individual workflows. If a workflow, for example, takes longer than 30 days, it may have a process issue that could be resolved with investigation. So that's one thing you can look at to dig in. Sometimes there's good reason for that. If you have a group that meets quarterly, for example, but even so, you would want to get your policies approved in 30 days and do these ahead of time before the meeting occurs. In policy stat, you can also monitor pending, and if needed, you can nudge the approvers with an auto-populated email directly from this report. This report is easy to run. It's on the drop-down list. It's available to view right on your screen. It's not an additional step to pull this up. So these are a couple of quick ways that you can improve your workflow efficiency. Moving on to the integrations between policy stat and audits and standards and how they work together. These integrations enable you to maintain policies that are connected to and updated with current standards and the ability to monitor compliance with policies and content. So we'll hear a lot more about this from Catherine in her presentation, but as a quick background, we define on the next slide assessments as periodic review of a program, service, policy, or other program in your organization, like a mock survey. This is what assessments are: a high-level view of your program. Rounds are an audit or a tracer or a checklist to monitor a particular aspect of a program, service, or policy. This would be like a focused review. But we all know that conducting policy audits and rounds can significantly impact the patient safety and lower risk. And I'll point out too that when you do your audits and your assessments, you can monitor not only the outcome of a policy, have we complied with the policy, but you can also audit the content of a policy. That's also important. Back years ago, we had a finding in our organization where there was a policy that for medical staff PIPI, and we thought we had a great policy. It seemed clear to us when we wrote it, but the new medical staff personnel who are doing those reviews, it was not clear to them that each of the files to be reviewed for the surgeon needed to be for that particular procedure. They just did the next 10 or 15 or whatever was prescribed, but they didn't do the exact one. So we had to go back and make sure our policy content was clear. So they followed the policy, but the policy content wasn't great. This is something you want to periodically check, particularly with a new policy. Maybe it's just a one-time check or periodically infrequent, but that's important when it's an important policy. Our goal today is to help you become not just survey ready, but also patient ready. And you'll hear about all of these things that are on this slide today, helping you to go beyond your survey readiness. You'll hear lots of examples from Catherine, how they've created hybrid tools where they have some incorporated on the unit tools, and then also they're using and leveraging the mobility of our audits and standards tool. So I'm looking forward to having you hear about those from her today. They'll show how it's easier to collect data, minimize your findings, and keep up with the evolving standards and make sure staff are ready to go. Catherine has the great examples of all these things, but I did want to note that while the majority of the examples that she'll share are centered around Joint Commission standards, there are campuses within her system that are only CMS as their accrediting organization. So they heavily consult CIHQ resources to guide their program, and they use the RLDatix platform to bring it all together. So that's a great value of our program, and I hope you'll find it useful as you watch how she has made all this happen in her organization. So Catherine, let's hear it.
So I want to start off by saying that I'm extremely excited to talk about survey readiness today. I can honestly say that regulation is a passion of mine because I know it helps drive patient safety and safe patient care. I know if my family enters any of our facilities, they will receive safe, high-quality care. I'm proud to work for the St. Luke's Health System, which is a community-based nonprofit organization and is the largest private employer in Idaho. Our healthcare system is extensive and diverse, comprising of 4 acute care hospitals, 4 critical access hospitals, 2 inpatient rehabilitation departments, 1 long-term care facility, 370 plus ambulatory clinics and centers, 2 home health and hospice branches, and many more services to help support our community. Our inpatient facilities have a total of 1,020 licensed beds. We are supported by a dedicated team of over 17,000 employees and over 2,000 physicians. Our robust network allows us to provide comprehensive and high-quality care to our community. Our organization takes pride in our commitment to quality and patient safety. St. Luke's Health System has been using audits and standards for a long time. When I stepped into my role about 1.5 years ago, our team realized we were underutilizing the software. Since then, our accreditation team has successfully integrated the Converge platform into our everyday practice. Here's how we achieved that. First, we looked at transitioning existing programs utilizing other data collection systems. We moved our data entry requirements to Converge, streamlining our processes and improving efficiency. This software has provided numerous benefits for data entry, including enhanced accuracy, easier access to information collected, and better data management. Second, we developed our new rounding tools, which created educational resources and standardization to our frontline staff and leaders while enforcing regulatory requirements and organizational policy. This has significantly impacted staff and leader knowledge and compliance. Third, we standardized our framework for rounding. By standardizing the framework, we developed a consistent approach for our quality teams, ensuring uniformity and reliability in our practices. Last, we developed tracer tools for our internal mock surveys and clinical rounding. These tracer tools helped us to identify compliance gaps during internal mock surveys, helping us maintain high standards and prepare for external evaluations. We did this using CIHQ and Joint Commission tracer tools and, of course, professional expertise. On the next few slides, I'm going to provide some additional details on what each of these initiatives look like. So I wanted to provide you with an example of how we had to think outside the box with integrating this software into our existing programs. So our teams have had an existing continual readiness program consisting of physical cards with content centered around regulatory topics. Some of these topics are checklist items such as checking fridge temps, looking at stained ceiling tiles, and then also keeping the path of egress clear. These daily tasks that staff complete or they look for during their shift, and then they attest to completing. Other topics such as blood administration, code elopement, and fire safety are examples of the other card type. This card highlights our focus of the month for all units participating in our program. We have a subcommittee that pre-selects the topic for each month, and all staff attest to reading the information on the card. The purpose of the monthly card is to reinforce regulatory readiness and increase staff awareness. Before, we were using Microsoft Forms to collect staff attestations, which was problematic for multiple sites trying to access their data. We transitioned this process to Converge by setting up rounding tools and an insights dashboard for leaders to access their staff sign-offs. Staff can complete these audits by scanning a QR code from their work phones or accessing quick links that go directly to the audit. This not only allows staff to speak up when they see opportunities for readiness in their departments, but it also enables leaders and accreditation specialists to ensure any compliance gaps are closed. Here is an example of the physical program pieces that are available on all participating units. As you can see, the cards are located in racks and have different colors based on the card type, either task or focus of the month. The QR codes are centrally located for staff to scan. The quick links are located on our organization's employee website. And then next slide. Here is an example of what those cards look like to give you a better visual representation. On the left is our monthly focus card, which has a why statement, high-level steps, review questions, and a reference to policy or resources. On the right is an example of our task-based card with those daily check items on there. Next slide. Here is an example of the rounding tool that staff attest to. They can choose their location, enter their names, and the card they are completing. Staff have the ability to write in opportunities for readiness, provide feedback on the card's content, and enter their shift. Once that is complete, staff answer that they have reviewed the card and enter the audit. I want to highlight that Verge allows us to make the right thing to do the easy thing to do. These audits take 10 to 20 seconds to complete, and they provide really valuable input from staff. So we set up an insights dashboards for leaders to have access to these sign-offs. Staff can report back opportunities to their leaders and ensure compliance gaps are closed and voice any concerns they have related to a process. Our local and system accreditation teams have access to this data as well and can follow up on any concerns submitted by staff. Attestation data is reported out through our tiered reporting structure, giving visibility to leaders across our healthcare system at all levels. One important tip, making sure you're sharing data with leaders who have influence and can really help drive change. Next, we noticed some gaps surrounding our rounding process. Teams are completing rounds on paper at different intervals and inconsistently. To address this, our teams created new rounding tools for regulatory compliance and patient safety. These rounding tools were designed for routine data collection from multiple roles, including frontline staff, leaders, and quality partners. The collected data then populates into various dashboards for teams to view. This data is shared through our tiered reporting structure. Some examples of topics for these new rounding tools were CAUTI, CLAPSI, surgical timeouts, critical lab values, restraints, and the risk for suicide or self-harm. Each of these audits are done by frontline leaders or frontline staff and then quality team members on a routine basis. Each of these rounding tools are set up a little bit differently. For example, our CLOPSI audits are designed with a visual observation question group and a chart review question group to ensure compliance in both areas. These rounds help educate staff and unit leaders on compliance with organizational policy, clinical skills, and documentation while providing data to our infection prevention teams. The surgical timeout rounds are designed to aid in staff coaching and provides a standardized question and process framework for auditors. Restraints and suicide self-harm audits were designed for our accreditation teams to help identify compliance gaps and to get just-in-time education out to our staff while ensuring these high-risk patient groups remain safe while in our care. These are just a few examples, and you can really set up these rounding tools however your organization works to make it easy for you. One important tip I can share is making sure to get input from both frontline staff and leaders to ensure your tool is value added. I believe this has made the biggest difference culturally in consistent auditing and rounding because they see the value in their work. Again, these dashboards are reviewed at regular intervals and shared through our tier reporting structure. So our tiered reporting structure ranges from local leadership, system leadership, and then up to our governing board. Now let's talk about our quality team rounds. In our organization, our quality team rounds to every unit within a 6-month period. Quality members consist of accreditation and infection prevention and can include other various roles from time to time, such as our workforce safety team. Our team created standardized tools for these team members to use that look at the physical environment and infection control practices. Leaders receive a report and are responsible for creating an action plan for every deficiency seen within 30 days. We are excited about the addition of our new clinical practice rounding tools that accreditation will use to evaluate everyday regulatory requirements geared more towards clinical practice. For example, this could involve observing a medication administration, watching a procedural timeout, or observing blood administration. Also included in these are some interview questions for staff on everyday processes like patient fall interventions, high-risk medications, and other essential topics. These tools have standardized questions and have linked standards right in the audit. This allows us to identify where regulatory gaps are. From there, we can adjust our continual readiness program to address these gaps. This helps us break the cycle of having the same regulatory issues every survey. So I've talked about our reporting structure, but I want to add that Insights provides us with real-time visibility into our results. Insights allows us to track problem areas over time, which can help us to determine future PI projects and where to put our focus. For our organization, we were really good at collecting data, but we weren't really great about analyzing that data. With Insights, this process has been streamlined, allowing us to share what is actually happening within our units, our facility, and then from a system perspective. Our newest project has been the creation of tracer tools for our internal mock survey process. We developed these tools based on a variety of topics and areas within our organization. For example, we have tracer tools specific to medical imaging, as well as more general tools that can be used in various settings, such as medication management. These tools were designed to standardize our survey process, reduce surveyor bias, and provide us a framework to ensure nothing is missed. Essentially, anyone in our quality team can use these rounding tools and feel confident in their surveying. This also allows us to provide site leaders with a preliminary report in real time so they can see where their gaps are right on the spot. Our goal was to mimic our Joint Commission survey process, and we have successfully achieved that. Here is an example of what that matrix looks like during mock survey. Next steps will include entering our past surveys so that we can really trend and ensure that we aren't having those repeat findings. So our organization is confident that with all of these tracer tools, we will have fewer findings during our next survey cycle. We will also have our pulse on compliance issues within our system and feel confident that there won't be any surprises. Surveys can feel overwhelming and scary, but our goal with these initiatives was to make survey a time for us to brag about the work that we do continually to maintain readiness. If anybody wants to know more about any of our processes, I'm happy to connect offline. Thank you.
Alrighty, thank you so much, Catherine, for breaking that down for us and showing us how the tool can be used in the real world and how you applied it and were able to capitalize on it to improve your routing process. With all that being said, I would like to bring Audra Geving in the room here to provide us with a quick demo so you all can actually see it live. I'm going to let her take over the screen.
All right. All right, thank you, Jaime. Can you guys, Jaime, can you see my screen? Can you just confirm that before I take over?
Yes, we can see it.
All right, thank you so much. So yeah, I just want to take a few minutes today and just kind of walk you through the actual solution itself. I know we got some really great screenshots from Catherine, but this will just really kind of highlight some of the features of the Audits and Standards solution. So first I want to start here in the standards libraries themselves. So the core of the product here is the resources, so the compliance documents themselves, and we store them within the standards library. Now we update and manage this on our end, so you don't have to worry about updating or changing these guidelines as they change and are updated. You're always going to get the most updated resources within the standards library. We have over 400 accrediting organizations and regulatory bodies that we work with here to store within the solution. And you can see a lot of them in here. But let's highlight kind of the topic of the hour here and look at some of these right here. Now you can drill into these chapter by chapter, section by section. You can really drill down to them, down to the very element level. And you'll see the content as it comes down from that documentation. And then over here to the right, we have that integration with PolicyStat. So you're able to pull in those documents from your policy library within PolicyStat, which again is our policy management solution. And it's very simple to do. So if I click this plus sign over here, it's going to open up that ability to search within my policy library. So for example, if I wanted to bring in my quality safety plan policy, I can type that in. It's going to search within the content of the and title of those documents to find that information. And then I can tag that and link it directly into the standard. Now from that data, you can see when it became effective, when it was revised, etc. You can see which organizations this is pertaining to. You can also click on that link, and that's going to open up that document right here within PolicyStat. We also have a standards area here within this policy. So if you click on that, you can see all of the standards that are linked to this policy. So for example, if I'm looking at medication management, I can open that up. I can see the actual standards, those guidelines. I can see those previous versions if they exist. So it's really powerful in terms of the ability to actually manage your compliance standing with regards to those guidelines. You can also pull in external links. So if you wanted to pull in a link to an external website, if you wanted to add some text or more information about that as well, you can tie those in. And that's going to make it available directly on that standard when we're actually looking at it. So you can always point to those resources if we need to. We also have a global search up here at the top. So if you're looking for something, you're not really sure what you're trying to find, you can search by keyword or content. So you have that ability to do that here. And again, this concept applies to all those accrediting organizations and those regulatory bodies. So that's a quick peek at the standards library. Now let's take a little look here at the rounding piece. And this is where we're actually going to perform those audits and checklists, or tracers, as some folks call them. And essentially, this is going to allow us to perform regulatory checklists to make sure that we're staying in compliance. There's a couple different ways we can do that. We can do that ad hoc, or we can just spin up a new round from here. I can see all the rounds that I'm currently moving through. I can see the historical ones that I've previously submitted. So I can always go back to previous audits that I've completed to see what went wrong within those audits. But I can also see a schedule of those audits. So if I want to build a schedule that provides my team the ability to do specific audits, 3 times a month, 5 times a month, whatever that process might be, it's going to allow us to make sure that's being maintained in a way that's more structured. So it's not just someone coming in here and doing it every once in a while. There is that goal-oriented and reportable structure to those audits. Now, in terms of what those checklists are going to look like, I'm going to click here to spin up a new round. And it's going to allow me to perform any one of these audits that we have stored within the system. And I can filter based off keyword search or category. So there's a lot of different ways you could organize these within the platform. We can also restrict visibility. So if you want to make sure that specific departments or specific teams only have access to certain audits that they need to or that are relevant for their role, we can set that up as well. Like Catherine indicated, these are also very easily accessible through URLs or QR codes as well. So you can scan that QR code on your phone or click that link on your tablet. It will scale that UI to make sure you can easily perform those audits on those devices. So let's take a peek and see what one looks like here. I'm just going to start this one. Now, when I click that, it's going to bring up a box of attributes here that we can build based off of these rounds to help make them more reportable. And these are fully configurable. So you can create your own fields of data that are going to act as attributes for these audits. Let me just fill this one in. We'll click Let's Round, and that's going to take me to this checklist where I can actually start moving through those audit questions. I can score them as compliant, not compliant, or not applicable. As I score these, you're going to get a color-coded representation of that score. Now, if I score something as non-compliant, it's actually going to ask me to create a finding. So it will require me to add an instance of non-compliance. So what went wrong here? I'll be required to provide that description. I also, so we'll just say in this case, we'll say that it was not posted in this example. You can also provide photo evidence to help support that claim. So if I click this, it's going to open up my file explorer where I can add that photo evidence to this claim. This can also easily be done on a phone or tablet. So if you click that link, it's going to open up your gallery or ask you to take a photo directly on your device, and you can upload it right from there. So it's really easy to capture that evidence as needed. Within these findings, you can also add some other information, so some detailed information on the area. You can assign those escalation users. So if you wanted to assign this to a group, maybe your quality team or your compliance team, you can also tag a specific person. You can also indicate whether or not follow-up is required. So if it's something, for example, maybe there was a cabinet that was unlocked and open, you're not going to escalate this to another person. You're just going to close and lock that door if possible. So in that case, you would indicate that that's not required. And then you can just provide a description about that mitigating action you took to actually take care of that issue. But in this particular case, we are going to say follow-up is required because we will likely need to, place a ticket to have someone post that signage above that door. So if you click create, that's actually going to then create a finding for this item. We also have a dedicated findings section here we can always point back to if we need to see what those findings are. You can also attach multiple findings. So if there are multiple issues going on, you can add multiple findings to this particular question. You can also link standards from those libraries. So you can link those directly to these questions. You can also have those policies that you've tied in. So if you have any policies attached to that, you can tie those in as well. Some other features here, you can add notes in here. So if there are extenuating circumstances, so for example, maybe this one is compliant, but I want to add a note saying that people report that it flickers every once in a while. So that might be something we need to keep in mind. So you can add those additional factors, things that might not affect the score directly, but things we want to keep in mind as we take a look later down the line. All of this is also keyword searchable. So if you want to find specific questions, so if you have a pretty big audit and you want to pull in a specific question, you can type that in. It's going to pull up those specific questions. You can click on them and it will take you directly to that question. Now, all of these rounds are, you can build these yourself. So if you have questions that you'd like to build, you can build out your own audits, your own rounds as you see fit. But we also have, a number of these kind of out-of-the-box audits that you can use at any point in time. Couple notes here about completing these. So a couple different ways you can do that. You can save this for later if you need to come back. You can also submit this and add another one. So if you're doing this for multiple locations, you can complete this one and immediately start up another. When you click that checklist, or that checkbox, that is going to kind of just submit this so submit this and escalate those to any findings that you actually found. You can also go into these question by question. So if you are an experienced auditor and you want to score them in bulk, you also have that ability. All right. So that's just a little peek at the rounding section. Now let's talk a little bit about findings. So once we've moved through those rounds and we've submitted them, there's going to be that historical data that you can go back to if we need to. But we also have the ability to close the loop on those findings. So once you complete those rounds, if there are findings and you've escalated them to those users, they're going to receive an email with a link to those findings that are assigned to them. But you can also find them directly within here just by clicking on that findings area. So within here, I can see all of the findings that are assigned to me. But if I want to check on, how my quality team, my compliance team is doing, I can also see all of the findings here as well. So I can come in here and review them. I have some filters here that I can use to filter down if I wanted to see specific organizations, specific statuses. You can choose a date range here as well. So if you wanted to see all of the ones that we've moved through in the last 6 months, you also have the ability. But as a typical resolution user, someone who's just going to come in here and look at those that are assigned to me, I can just click that and see all of those findings that are assigned to me. You can also see any of the ones that have that photo evidence that are available. Now, if I click on this ID over here, it's going to open this up and give me more information on that finding. I can see the question that this is associated with, the description. There's that photo evidence. You can also see the corrective action. So if we want to take a look at that corrective action, you can check whether or not it was completed. You can also add a corrective action in here as well. We also have that other information, so we can link those standards, those policies right to this finding. I can also clear out multiple findings at once. So if these are related, I also have the ability to do that. So lots of different ways that we can move through these. But that's essentially how you would close that loop to indicate that these have been resolved, that they're no longer issues, helping you improve your safety culture. So now let's take a quick peek at the assessments piece. So we have those assessments where you can populate those mock surveys or official survey results. You can spin up a new one over here. You can also look at specific ones. So if we wanted to pull up an example here, we can pull that up. And when we click that, it's going to open that 5x5 matrix here. So all of these areas here are going to represent different elements or standards that we're in non-compliance with for this assessment. If you click on any one of these elements, you can click in there and quickly identify where your biggest problem areas are. Any findings that have been tagged in through those audits or those assessments are going to be added here. If there's any photo evidence, that will be viewable. If you go over here to the details section, you actually get the actual guidelines themselves. You can scroll down and see that additional information. You can also see kind of what that looks like within the auditing as well. You can also add findings directly within here. So if you know exactly what's the non-compliance, you can add a finding directly within here. You also have the ability to start rounds right from within the assessment. So if you wanted to utilize scoring this the same way that you would score a day-to-day or week-to-week audit, you have the ability to do that. All right. We also have an overview area here, and this is one of the reporting features in the system. This one is specific to those assessments. So if I wanted to just really quickly come in here and see what issues we're having with our specific standards, I can do that. I can select a date range, specific organizations. Maybe we're just looking at a mock survey or there's official survey results. I can come in here and take a look at those assessments element by element and see how we're scoring. I can pull one of those up here. You can also see any findings that have been tagged in to those specific elements. So these link directly back to the standards themselves. So if I want to view that content, I can click on it and again, see those findings that have been tagged in and then view the actual guidelines directly within this area as well. To talk a little bit more about some reporting features, if I go back here to our rounding section, we have a reporting capability here. So in here, I can view for these audits, I can see how well we're doing with that compliance week to week, month to month, year to year. I can go down here and see how we're doing question by question or organization. I can go, if I wanted to see our findings here, I can click on ascending or descending order to see how well we're doing here. I can also see that finding volume and current status. I can also export any of this information. So that's just an informal way an informal way to report on the findings within the platform. Now, I just want to take another minute or so and talk a little bit about Insights, which is our analytics tool platform. And I could spend, 30, 40 minutes talking about this, but I just wanted to quickly highlight this. So this is going to allow you to see the information in these dynamic visual dashboards. So right now I'm on the auditing compliance analysis, so I can see those rounds and those findings. We also have areas for those findings, those action plans, as well as assessments or mock surveys that could be completed. These are all out of the box that come standard with every new account, but you can also build your own. These are fully configurable. But within this one, I can see how many rounds we've submitted, our compliance rate with those rounds, how we're scoring per location, by chapter, by standard. You can also drill down to specific sample sizes. So if you wanted to look at a particular area, you could drill in there. We also have a number of filters here that you can use to filter by specific audit or question or chapter. So you have that ability to do that within here. So like I said, I could spend a lot of time talking about this, but that's just a very high level overview of the Audits and Standards solution. And now I will send it back over to Jaime.
All righty. Thank you, Audra. Appreciate that demonstration. I think it really helped connect the dots between what Catherine was speaking about and then how the solution looks and feels and how it works. So with that being said, I would like to turn it back to Cheryl to talk about connection and collaboration. And just a reminder and to people in the audience, please feel free to leave questions as we're going to get to the Q&A section soon. So take it away, Cheryl.
Thanks, Jaime. That was a great overview, Audra and Catherine. So insightful. Our final topic is connecting and collaborating. First, we'll talk about interdisciplinary collaboration, and then we'll follow it up with colleague connections. But since we have such a healthy mix of quality, accreditation, compliance, and policy stakeholders, I'd like to reflect back on all that we've heard and the importance of connecting policies and monitoring compliance, quality, and safety in our organizations. And just say that, policies set the tone for our culture. They're the backbone of compliance and communicate and define our values, goals, and objectives so that culture does not morph out of control. They define what's acceptable and unacceptable. And this starts, as you know, with our legal and regulatory requirements, but it also establishes the values, ethics, commitments, and social responsibility of the organization when it comes to matters of discretion. Examples, and some were mentioned by Catherine, maybe a surgical timeout policy, a patient confidentiality policy, an expense policy, or facility maintenance policy that addresses the use of extension cords. Each of these policies require action from you and your colleagues to ensure safe organizational culture. And I'm sure you've said to people in your organization that they may face a situation where they need to stop a procedure, end a conversation, or call out a coworker's activity. And that's when policies get real and can have significant impact on safety and culture. Similarly, monitoring compliance, quality, and safety, it helps hold everyone accountable to the expectations of the policies. Catherine described how involving staff in the audit process reinforces accountability, and displaying results provides an opportunity to maintain compliance, safety, and high quality, but it also can be a tool to reward effort. So with all this in mind, we'll now consider a broader view of collaboration. On the next slide, interdisciplinary collaboration. It really is teamwork, right? It's reaching between the swim lanes of the silos in our organizations to connect information and resources to improve the safety of our patients, workforce, and our organizations. On the next slide, it's a good way, this is a good way to look at the interdisciplinary collaboration from an RLDatix perspective, taking a high-level view of what we call connected healthcare operations. This diagram shows most of all our RLDatix solutions currently. As you know, we're an evolving company and growing on a regular basis. But today we've discovered how regulatory and policy management, which are over to the right and in the green boxes, and we've talked about these, and we've discussed briefly how these integrations between these, but there's more. Within the compliance bundle, for example, it's also possible to connect policy documents to manufacturer guidelines. As your eyes kind of float to the left, you'll see the risk and safety solutions where event files can also be connected to policy documents. We are also developing integrations with our provider, contract, and workforce management solutions. And Galen, and I don't know if that's displayed on your view, but it's a relatively new partner that handles data archive management for our customers, and it's also helping us with our cloud migration. Another new partner is Social Climb. This is an experienced provider in reputation management and patient experience and data insights. So all of these together we call our connected healthcare operations, and it's the collaboration, the interdisciplinary collaboration that really has value in the RLDatix solution sets together. The next couple slides are just quick overview of some of what you've already heard today. We've already discussed policy stat and audits and standards and the integration earlier. On the next slide, you'll see an example of adding manufacturer instructions from one source to a policy stat document. It's a little busy, but what I'm showing here is an example of when you build a policy, how you can add in the documents there on the left, and then to the right is how you can view those documents that have been added in the table of contents, but then also later down in the body of the document. So this is also a very valuable opportunity to connect documents. The next slide, it shows what we call our RLDatix icon wall, and it's a little small, but highlighted there is where you can see there's already an integration with risk and safety and with our RLDatix solution for risk, where you can add files to add policies to files if you need to, and to help round out an RCA that you may have started on an incident. The next slide is just a brief view of our risk and safety. It's one of our new and emerging versions of our safety solution. It is a little more standardized, and there's some advantages to that. If you're interested in learning more about that, let us know. But it will also have, as noted on the slide, all kinds of links to standards and adverse events, but the ability to link with the solutions that we've mentioned today and others. Eventually, all of these will be connected in our connected healthcare operations, and our risk and safety solutions and our policy solutions are all at the center of those connections. So you'll see more about this in to come, but this is just a quick overview of what you can expect from a technical collaboration. But these also, of course, represent the people groups, right, that work with all these solutions. Next up, connecting with your colleagues. And I'll share with you a couple of ways to connect with your colleagues starting today. Right now, if you're a policy or RLDatix customer, you've probably already heard of Hub. Hub is our connection group online where you can connect with by chat, but there's also lots of other things you can do in there. We've got some groups that we've set up specifically for audits and standards and policy networking, where beyond just chatting in Hub, we actually meet on a regular basis. So our policy networking group meets monthly. We have a special laboratory group that meets every other month, and we're shortly will be spinning up our audits and standards group. For those who wanted to take it offline, I call it Hub 3D, because you can actually learn just like what Catherine showed today in her examples. We're sharing ideas, we're learning from each other, and it's a true networking opportunity on a regular basis. This is also the place where you can find articles and information, post new ideas, and where when an idea has been taken into development, that it'll be posted in the appropriate chat groups for that solution, so you can see what's new. So it's a good place. If you've not been there lately, you should check it out. And then on the next slide, we have this year a Connected Healthcare Summit. It was formerly called Palooza, but now it's called the Connected Healthcare Summit. And it's just around the corner in sunny San Diego, California, right in the middle of March. So if you're available and are interested and would like to join, hear more customer stories like what Catherine shared today, it is pretty much dominated by customer stories. There's a few other presentations worked into this conference, and because it's good for everybody to hear what's on the horizon and what's in development and how are these connections coming that we're talking about. But it's a good way to physically connect, not just virtually, with all of your colleagues, and to hear about what's new and to learn from those who've gone down the path before you. So feel free to scan that QR code if you'd like to register. We'd love to see you.
Okay, thank you so much, Cheryl. So we did promise that we get to questions, so thank you all for hanging on a little bit longer, your lunch break here. I will go ahead and pull up the Q&A, and we'll start going through some of the questions here. Okay, so a question to Catherine, Cheryl, Audra, if you want to chime in on the technical side. This is regarding policies, links to standards. So maybe Cheryl, you can tackle this one. What are some limitations to this? Is it linked to Joint Commission standards only, or can references to American College of Surgeons, CMS, etc., be linked or attached there?
We have the ability to link to pretty much any accrediting organization. So even some of the specialty ones, we can do that. So all of Joint Commission, CMS, state regulations, and of course CIHQ and others. So lots of options there. If you're interested in a specific one that we don't have yet, then we'll take steps to help incorporate that so that it can be included.
Perfect. And this is a question for Catherine. Is the QR code scanned by staff-owned devices or facility-owned devices?
Yeah, it's both. So we like to encourage people to use, our staff to use their workforce phones. At our organization, they are smart Apple phones. But in some areas, or depending on your role in the organization, certain staff don't have those workforce phones supplied to them, and so they do have the ability to use their personal devices. It just is going to depend on your workforce cybersecurity team. We have a multi-factor authentication that our IT program runs, and so you probably need to check with your department and see what that looks like for you.
Okay, perfect. Actually, quite a bit of interest in the cards. We have some individuals in the chat who want to reach out to you, Catherine, so we'll send those over to you. Let's see. Can someone, okay, more context for Catherine. Are notifications triggered when standards are updated externally?
I can take that one. Sure. Yeah. So when we update the standards that we store, you do have the option to have members of your teams get pinged for those changes with summaries of what has changed. So, yes.
Short answer, yes. All righty. Thank you, Audra. Cheryl, could you answer this one? Do you have any audits or rounds for sterile processing departments?
Yes, we actually have a whole list of best practice audits, and I'll be completely honest with you, we are working through those. I've gotten several done, but in the past it was one big long audit, and now we're breaking it down to short, medium, and long, because sometimes you just need a quick spot check, and other times maybe a little, like 5 questions. Other times you might need a little bit longer, and then when we have a serious challenge, or if it's a time when we're focusing on a particular area, maybe it's sterile processing, then you want to do a thorough audit. It'll have the full complete set. We've also, as part of this revamp of our best practice audit tools, we've updated it so that it's not slanted towards one organization, accrediting organization or another, and we've included a broad set of as many standards that would apply to that topic as possible, so that you have a more well-rounded survey or audit tool. So more to come on that, but yes, we do have central sterile audit tools, and if you follow up with me later, and we can talk about that.
Love it. And then for state regulations, is it customized per state?
Yes, all of our audit tools that are available, not audit tools, but the standards can be state specific. Those are all included, you know, in it. We add them as we need them, right? We haven't just loaded up all the state standards, but if we have a customer that needs a state specific regulatory information, then we'll put that in as we need to. We add them as we go, but filled up many of them.
Awesome. Another question. So collaborating to build audits with frontline teams can be quite challenging with the ANS platform. Are there any plans to add the PolicyStat collaborative tools to audits and standards?
I don't know if I understand that question exactly.
Mm-hmm.
Can you clarify, or where? I just don't see it.
Yeah. So I think the biggest piece here is maybe just the collaboration piece. So you can collaborate to build audits with frontline teams in Converge. Maybe they're talking about the notification system, I'm assuming, with PolicyStat. Is there something similar in audits and standards for team collaboration?
I don't know about that one. Audra, I don't know if that is something you have. You mean, maybe what they're talking about is in PolicyStat, you can invite collaborators to comment on a policy document while it's in the review process, or at any time they can contribute to that. But I don't know, and I don't know if I'm understanding it correctly, but I don't know if that's something that they're asking for the ability to comment in audits. There is a place to leave feedback on audit questions, right, Audra? So if you have a question, or during an audit, if you need to consult a policy, if it's linked to that specific question or to that audit tool, you can quickly pull it up in a pop-out window. So maybe you're doing an audit and you need to consult the policy, you can pull it up. Is there anything you'd add to that, Audra?
Yeah, I was just going to say it sounds to me like they're referencing the collaboration tool within PolicyStat where you can add others in. As far as I know, that's not in the works within the Audits and Standards solution, but we can certainly add that as an idea. We're happy to add that in. We're always open to those great ideas.
And since looks like there's a little bit of a elaboration here, so it says. Or Alyssa says, being able to tag SMEs, track edits / changes. But I think we can follow up on that a little separate. And then I think those were most.
I saw one down there about CAP. We do have the CAP regulations, and I've actually been asking the lab group if they wanted to, align an audit tool with CAP. I know CAP already has a method to do their laboratory auditing on their own. So, but I'm happy to hear more about your ideas around that, because that's something we've been talking about. So I just happened to see that. And I saw another question about getting to Hub. Maybe we can post for them the link to Hub, because it's certainly easy to sign up to Hub. There's a one-time registration and then you're in.
Yes, and we will be following up with a email with just some information after this webinar for all those who attended and registered. So we will make sure to send in some steps on how to log into Hub there too. So I think lastly, just to wrap things up, Catherine, can you maybe elaborate on how you were able to galvanize your team to update their workflows and prioritize patient safety?
Yeah, so we kind of got a boost after our last triennial Joint Commission survey. So our organization decided to do a Big Bang approach. So all of our Joint Commission accredited sites were surveyed all at the same time. And so after that, we were able to action plan and come around all of our deficiencies as a system rather than just individual sites. So that really led the way towards prioritizing auditing and rounding into everyday practice. And then we already had our continual readiness program up and going, but moving it and transitioning that, which we did within the last 6 months, over utilizing the software and really making sure leaders had that access to their data, has just really helped provide visibility to all of that data being collected, and it really is providing that value add. And so I do think that we were able to cement in those processes in auditing and rounding.
Perfect. Thank you, Catherine.
Mm-hmm.
So lastly, just wrapping up here for the few that are still around, full questions for you all, just to gather some information on what interested you in today's presentation. When learning about audit standards, would you like to learn more about the solution? Please mark A for definitely. Maybe you already have the solution, or maybe you're not considering it at this time. Either way, we would love to hear from you all. So we'll leave that poll question up for a second.
Okay, we've got 40% at definitely, 35% already have, and less than 30 at not right now.
Okay, perfect. So we will make sure to send us some follow-up information for you all. And then lastly, are you interested in any other solutions? So like that slide Cheryl presented with workforce, OneSource, policy even, please mark A for definitely or B for not right now.
Yes, and nearly 50% are definitely.
Okay, perfect. All righty. Well, thank you all again for attending our presentation here today. Thank you, Catherine, for joining us and putting all those slides together and telling your story. And thank you, Cheryl and Audra, for presenting too. With all that being said, I'll turn it back to you, Michelle.
Thank you again very much for this presentation, everyone from RLDatix and Ms. Catherine as well. There are no further questions in the queue. Someone did clarify for me that CAP, in my knowledge, it was a corrective action plan, but it's the College of American Pathologists lab specific. So that's wonderful clarification. Thank you. So this will be, this has been recorded. It will go live on our CIHQ ARS YouTube partner page, open and viewable at any time. We've got one more question from Jorge Contreras. Will staff need to have an active account in Converge before they can scan the QR code and enter the program? I'll mute for that response.
Audra, do you know the answer to that question?
Yes, I would say, I mean, you would need to have an active ANS account to be able to access those QR codes. That would be my answer.
I can elaborate what we did in our organization. So we did have to come around that issue because before I was opening accounts manually, and for that 17,000 plus employees, I was overwhelmed by that. So we got with our Verge team, and they allowed our organization to do a single sign-on. So staff will scan or click into the audit link, and it allows the staff member to auto-enroll if they don't have a Verge account. And that streamlines that whole process. So it's pretty nice.
Wonderful. Okay, there are no more questions in the queue. So RLDatix has posted contact information. Feel free to reach out to them or to me, Michelle Schaefer, at the link or the email that you registered through. Have a wonderful afternoon, everyone, and thank you again to the RLDatix team and Ms. Catherine.
Thank you so much. Have a good afternoon.